Hi, it's Rhett Baker, and I am on vacation, but I want to chat with you about House Bill 73 that's currently receiving hearings in the Senate Health Committee. So this bill has to do with the regulation and ability for healthcare providers to prescribe off-label drugs. The use of off-label drugs occurs when an FDA-approved drug is used for a reason it wasn't approved for. For example, let's say there's a specific chemotherapy medication that's FDA approved to treat one type of cancer, and then it's prescribed to treat a different type of cancer. That would be considered off-label use. The FDA approval process is extensive, and lots of medications are used routinely off-label, especially in pediatrics. House Bill 73 would give a healthcare provider the ability to prescribe any FDA-approved medication for off-label use, which is already legal. So what's at the heart of this bill? This bill takes away the ability of licensing agencies, Ohio Board of Medicine or pharmacy, from being able to intervene with pharmacists or physicians for prescribing any off-label drug that goes against science. Additionally, this bill provides safeguards for healthcare providers who express a medical opinion that does not align with approved evidence-based medical practices by a licensing board, a local health board, or the Ohio Department of Health. Under this bill, no administrative or disciplinary action can be brought forward against a provider who is practicing based on their opinion that is different from evidence-based science. I worry that this takes away patient protection from bad player providers who could take advantage of patients' desperation to find a treatment, and there would be no accountability through a licensing board overseeing these providers. This bill also addresses a situation where a patient is hospitalized and requesting a treatment that the hospital providers are not willing to provide. Most often, this would occur because the patient is requesting something that is not a true evidence-based treatment. In this case, if the patient finds a provider who is willing to prescribe the medication or treatment that they want, the hospital has 5 days to temporarily privilege that provider so that the outside provider can come in and prescribe care within the hospital. This bill specifically lists that the hospital, the pharmacist, and the hospital physicians aren't liable for problems that occur as a result of the treatment that patient requested. Interestingly, hospital nurses are not included in the list of professionals who are not liable if something goes wrong. I worry that this could place nurses in a difficult situation of the prescribers that they work with every day being uncomfortable with the treatment, and now a temporarily privileged outside provider is writing orders for them to follow. House Bill 73 has its third hearing next week in the Senate Health Committee on June 12th. If you're interested in watching it, tune in to the Ohio channel and look at the links below.